Hello friends, today we are going to discuss a homeopathic medicine, Gelsemium. We are going to discuss its characteristic features, characteristic symptoms, and how it will help you to prescribe medicine for the patients. Starting with the sphere of action, the main spheres are circulation, circulatory system, heart and blood vessels, motor nerves and muscles, brain cord, spinal cord, and neck, and the mucous membranes. Starting with the symptoms of mind, the first is the patient is expressing the fear and fright, fear regarding some new events, regarding some disease process, regarding their future, and same they are going to have some effects of fright. Next is anxiety about certain new task, new events, etc., and which will follow the physical symptoms, like patient will have some involuntary discharges, patient will have some involuntary uh, evacuations or some other dullness or drowsiness. Next, very characteristic thing, examination funk, like patient is going to give you symptoms that they are having some dullness of mind, forgetfulness, weakness of memory, anxiety, fear before examination, and then they are going to suffer with a different physiological changes. Next is incoordination. Incoordination means they are not having some regulations or some control over their movements, and they are going to have failures in their day-to-day task. They don't know how to coordinate the physical things and the mental thoughts also. Next is they are also having some impulsiveness or craziness. In some acute diseases or acute conditions, in acute febrile diseases, you will observe this particular kind of symptom. Patient will become impulsive or they behave like a crazy person. Then awkwardness. When you have combination of fear, anxiety in coordination, a person will express this thing in awkwardness, like they are dropping the things from the hands, they are not having the proper gait, and they are not behaving that they can control their surrounding. Okay, so this is the combination of mental state the patient or person will express one at a time, and or the combination of two or three or more, and then they will help you to prescribe the medicine. Next, we will discuss the physical generals. The first is dullness and confusion. The dullness or confusion that are arising in a mind, that you can also observe at a physical level, that you will find that very dull and drowsy patient don't want to do any work, don't want to communicate with the doctor, and if they are going to communicate, they communicate in a confused manner. They will mix up the symptoms, they will mix up the events, etc. Next is they are having paralytic weakness, means the weakness which intensifies itself up to the level of paralysis, like there is no degenerative changes in system, but still the person will express that they are having some paralysis, and they cannot hold the hand, they cannot hold the limb, they cannot stand, they cannot walk without support, etc. Next is the complaint is having very gradual onset. Okay, like bryonia, you can also say that this medicine is also having very gradual onset. Symptoms appears very slowly, or after the exposure to their causative factor, the symptoms develops with some very delayed factor or delayed time. Next, the person is having decreased appetite, not having any sensation or not having any desire to eat anything. Next, the medicine, if you look for pathological conditions, it is indicated for very slow inflammatory processes, Okay, unlikely aconite or ferrum-phos, belladonna, which are having a very fast and very intense kind of symptomatology, but this medicine is considering covering the slow inflammatory process. Okay, so these are the final physical generals which you can look for to prescribe this medicine. Then the next sphere of action is circulation. Circulation, very characteristic, you will find the congestion or congestive criteria with palpitation. Patient will have throbbing or irregular pulse and very characteristic the flushed face. Next, you will find the coldness of extremities and heat of face and back. So centralized, the person is going to express the fever, and the peripheral extremities, you are going to observe the coldness. Some peculiar symptoms of Gelsemium are: the first, dryness of mucous membrane. Next, it is indicated for intermittent and continuous fevers. Next is lethargic feeling of weight in internal parts. Okay, the patient will always complain that the feeling of lump sensation in throat or stomach or intestine, etc. Next is can't lift the head or limbs due to weakness. So on account of paralytic weakness, on account of incoordination, they cannot hold the limbs or cannot lift the head without any support. Then loss of functions due to paralysis or weakness. Now the internal functions or internal organs are so much so weak that they are having a sensation like they have lost their function. Like the patient is going to suffer with the problems of digestion, problems in somewhat of evacuation of urine, stool, etc. And they are always going to say that either I am having involuntary diarrhea or I am having some incontinence of urine. Okay. Next is congestive headache, and patient always wants to lie down with head high. Modalities for this medicine are: this aggravates complaints arises or complaints increase from motion, then hot weather or heat, sudden surprise and emotions. And the general amelioration they are having from any kind of discharges like urination, like sweating, etc. So these are the final gist or final remedy picture that you can remember, you can use to prescribe this medicine. We are having so many characteristic particular symptoms, but if you can find this picture in your patient, you can prescribe Gelsemium and you can treat patient's condition. So these are the reference work which I had used to prepare this medicinal picture. And for more information or for any suggestion, comments, you can visit and you can write down your comments, your suggestions on these particular sources. Thank you so much.